Welcome back, dear doctors, after a long break. I, Dr. Syeda Sara, welcome you all in Anatomy Student Zone. Today I will cover gross anatomy of nose. Before I move to this topic, I will recommend you to please go through the first video that I have made on this respiratory system because this video will provide you a basic knowledge that will help you a lot. I know you will be knowing what are the anatomical and the functional divisions, and because I have described in a previous lecture. If you don't know, don't worry. Quickly, I'm going through this because it's important to cover this detail before going to start this topic. So anatomically, the respiratory system is having upper and the lower respiratory tract. Already covered in our first lecture that the part of a respiratory tract that will above the cricoid cartilage and vocal folds, that is upper respiratory tract, and a part that is below cricoid cartilage and a vocal fold, that is your lower respiratory tract. Upper respiratory tract include or its component are nasal cavity, paranasal sinuses, pharynx, and the superior part of larynx, while the lower respiratory tract includes the inferior part of a larynx, trachea, bronchi, and bronchioles. So the lung are also part of your lower respiratory tract. You know, the upper respiratory tract warms, humidifies, and the clean about 1,000 to 21,000 liter of respiratory gases daily. It means our nose is part of upper respiratory tract and it's going to warm, humidify, and clean the inspired air. How it's doing all this? It's all about its anatomy and the histology that you have covered, what cells are going to do this. If I talk about the functional or histological domain of a respiratory system, I will say functionally the respiratory system is having two components which are conducting and the respiratory portion. And again, you know, conducting portion consists of all parts that conduct air and bring this air into lungs. While the respiratory portion, this includes the part where the gas exchange actually occurs. So it consists of respiratory bronchioles, alveolar duct, and the alveoli. So of course, the nose that I am going to cover right now, it is a component of a conducting part histologically. Anatomically, the nose is a part of a respiratory tract that is superior to a hard palate. So this is a sagittal section of a head region. You can observe the hard palate over here, and we can see nose is a superior to hard palate. So I can also say the floor of a nose is formed by means of hard palate. It's same, you already know the nose contains the peripheral organ of a smell. So it's the same function that it's going to do. So in anatomy of a nose, if I ask you about the part of a nose in gross anatomy or anatomically, I can say the nose includes external nose and nasal cavity. And the nasal cavity is further divided into a right and the left nasal cavities by means of nasal septum. So first I will cover the external nose in this part, and later on I will cover the nasal cavity, what are its walls. So here when we cover the external nose, you know, this is the part of a nose that is visible to us, and we know this part or a visible portion, it projects from your face. So you will be thinking why you should know these parts of a nose or external nose. It's very easy. I will say it's not just you are thinking. It's all because the medical professional, they usually talk in a medical terms. And if these medical terms are going to be used, you should know what parts they are going to name or what they are talking about. So it's also important if you are a plastic surgeon or if you are an ENT specialist, you should know about the rhinoplasty. So rhinoplasty is a surgery that changes the shape of nose. And why we change the shape of a nose? Of course, to improve the breathing, if the patient is having deflected nasal septum, or it can be due to cosmetic reason as well. So both the breathing and the nose shape, they are closely related to each other. And a rhinoplasty can be used not only to change the shape of a nose, but also to improve the breathing as well. So it can be due to aesthetic purpose as well. So there can be a different type of rhinoplasty. It can be reshaping of a nose tip or a bridge. So what is a tip of nose? What is bridge of nose? Besides this, there are also other part of external nose that you should know. So moving towards the main topic. External nose, anatomically it's having ala, dorsum, root, tip of nose. So what these part are, I am going to cover right now. So there are two sides of our nose, you know this, and point where the side of nose meet in a midline anteriorly, this part forms the dorsum of a nose. So upper part of dorsum is bridge of nose, as you can see here, and the lower part of dorsum is apex or a tip of nose. In simple words, I can say dorsum of a nose extends from bridge of nose to tip of nose. Most of students confuse in exams or in a viva about the root and a bridge of nose, as some books have mentioned the root as in bridge. But make this point clear over here. I have told you already that the bridge is upper part of a dorsum of nose, and this is a junction of a cartilage and a bone. As you will see later that the skeleton of nose, it's form of a cartilage and a bone. So at this junction, that is bridge of nose. So the part of nose that is between two eyebrows, it's your root of nose. So root of nose is a part of nose that is continuous with that of your forehead. So the nares or the nostrils or anterior nasal aperture, these are two piriform openings, and these piriform openings are located at the inferior surface of a nose or a base of a nose. So base is bounded laterally by the ala or a wing of nose. So you know the superior bony part of a nose and its root, it's covered by means of thin skin, where it's loosely attached to the nasal bone and the upper lateral cartilage, while the cartilaginous part of a nose is covered by means of thick skin. And this thick skin is having many sebaceous glands, and it's tightly bound to that of a alar cartilages. The skin of nose that is covered, it's bony and the cartilaginous part. Besides this, this skin also extends into a vestibule of nose, so where it contains the variable number of stiff hairs that we named as vibrissae, and usually these are moist and they filter the dust particle by means of air that is entering your nasal cavity. It is clearly filtered by means of these particles. So beyond the hair bearing area, there is a junction of a skin and a mucous membrane as well in the area of a nose. So that was all about the external feature of a nose or anatomical points that are present externally. In the next part, I will describe the skeleton of external nose that consists of a bone and a cartilage. So till then, have a nice day, take care of yourself, and please don't forget to appreciate the efforts by hitting on like and a subscribe button. Thank you so much.